How to inject Iluvien safely.
So make sure all the parts of the applicator are okay, and check the implant inside the applicator as shown by this violet arrow. Then you start priming the applicator to move the button down and then forward till the mark. Then it will go up again after release. So now your applicator is ready for the injection. This is the diabetic macular edema pathway as discussed before in previous videos. This is a patient with chronic diabetic macular edema non-responsive to previous treatment as shown here in the OCT scan. You begin with sterilization of the skin after putting the topical anesthetic and topical povidone iodine to prevent any infection. Then we put the eye draping and make sure that the eyelashes are covered and away from your field. Then you'll open the drape and put the eyelid speculum, avoid injury to the cornea, and you mark 4 millimeter from the limbus, and you have to be perpendicular to the limbus to avoid injury to the lens. Remove the cap of the applicator and use a cotton bud to counter pressure when you start injecting. Now we are starting injecting, and you might find a little resistance and then it will go. Be perpendicular to the sclera to avoid injury to the lens, and fixate the applicator with Rashad's bimanual technique, and then you press the button till the end of the track. Then you will find the implant is inside the eye here, and it is behind the lens in the vitreous. Then you can go out when you are sure that the implant is inside and press to avoid any reflux of the vitreous and stop the little subconjunctival hemorrhage. Now when I press, you can find the implant is moving freely in the vitreous behind the lens. Check the counting fingers vision after the injection, and then put antibiotic eye drops. Then remove the speculum, tell the patient to look down and then up, and then remove it. Now you can see here, after cleaning all the povidone iodine, you can tell the patient to look up and down, and you can see the implant clearly inside the vitreous. And check the applicator and see the button is at the end and depress down, because sometimes you cannot see the implant inside the eye. Prescribe antibiotic eye drops 4 times a day for 1 week. See the patient in 6 weeks to check the pressure and the vision, and you can see here marked improvement in the vision and OCT scan, and the patient is very happy. Thanks for watching.
If you have any questions, write your comments on Ophthalmology Eye Academy, Mr. Mohammed Rashad YouTube channel.